Hello, and thanks for tuning in once again. Joe DiMatteo of the Len and Joe Ask the Pharmacist radio broadcast. Go to our website at lenandjoe.com for details and information when we broadcast, times and places of our broadcast, Sirius Satellite XM radio, and for a lot of the other videos and so on that we do have available for you. We've done just recently a couple postings and teachings about part 1 and part 2 of the perinatal, before pregnancy. We called it preparing for pregnancy, some factors that you should know about. This one will deal with the prenatal process, factors that you should be concerned about once you have conceived. There's a family history of problems with miscarriage. If you've had miscarriages before, you should talk to your physician about understanding and knowing what the role of progesterone is. Biologically active and biologically identical progesterone could play a key role here. Now, certainly there are many other factors that could influence. Sometimes there's an autoimmune component that you should be evaluated for the potential with miscarriages if it's been recurrent. Number 2, understanding that in some cases gluten and celiac disease, gluten intolerant, celiac disease, if you have any digestive problems or digestive difficulties, that should be ruled out because it's associated with infertility and the potential for not maintaining a implanted egg, conceived egg. So let's go over some of the basics, though, about and during pregnancy and some things that you should know. Number 1, we do not recommend fasting of any type. Women suddenly are pregnant. Okay, I must make changes. I'm overweight. What am I going to do? Well, I've got to lose some weight here. Maybe I make bad decisions. I start restricting calorie intake. I go on to restricted types of dietary components. Bad thing. Do not fast. Small multiple meals, quality sources of protein at each meal, more vegetables, more fruit, raw nuts, seeds, clean sources of poultry, preferably organic or free-roaming, free-range, adequate amounts of fish, and red meats should be of the free-range, free-roaming, grass-fed, and possibly even organic. You can still have grass-fed, non-hormone injected meats and not have it be organic. That's good, as opposed to corn-fed, which is very pro-inflammatory, produces a lot of pro-inflammatory proteins in your body, which is not good while you're carrying your child. We also find a research piece that said individuals that had a very poor diet versus a diet that was richer in vegetables, fruit, and poultry, let's say not even poor diet, but let's just say lots of vegetables, lots of fruit, poultry, some fish, some quality sources of red meat versus a diet that was very high in dairy and red meat. 26% increase in the rate of small birth weight or diminished birth weight, under weight babies being born. So there's no doubt a corollary to what you consume and the foods that you consume during pregnancy. We talked in the the perinatal phase how important it was to understand the role of good bacteria in the stomach for you, probiotics, and D3. You should have a 25 OHD level done. If you're now pregnant, it's a must. Before we talked about it even preparing for pregnancy, now you must understand what the role of D3 is. D3 plays a key role in helping to maintain immunity in not only in your body, but in your offspring. We find lower rates of autoimmune disorders, type 1 diabetes, etc. in children with moms that had adequate levels of D, 25 OHD, during gestation. We also know that lots of good bacteria. Studies have shown that women that may have a potential for a child to have a lot of allergies and eczemas and dermatitis. Well, how would I know that? Well, if one of the parents have dermatitis, ectopic disorders, atopy, asthma, the potential for the child goes up dramatically. If both parents, it's just skyrockets, the potential. Well, literature and studies have shown that if you put moms on probiotics during the time of gestation, quality forms now, I would not just go pick up some bargain basement brand any anything off of the shelf. You've got to have a quality formulation that gives you a broad spectrum, human strain, quality formulations to make sure that they're cultured correctly, they're viable strains, and they don't have any aberrancy in strains, and absolutely not animal sourced. So that being said, what does it do? It reduces the incidence or the potential incidence that the child, your offspring, will have dermatitises, eczemas, atopy, asthma type symptoms or potential for that by just you doing quality sources of probiotics. The other area is understanding the role of trans fats and good fats. Bad fats, trans fatty acids, deep fried, hydrogenated fats increase the rates of miscarriage. Literature shows and proves it. Number two, good fats, especially quality omega-3 that have high DHA, can not only help neural development, neurons in the brain, retinal health and development in the child, but we also know it has an impact on the child's ability to learn, their reasoning skills, and literature supports an approximate 10 to 15% improvement in offspring of moms that have taken DHA at a high dose. Now, the key point is here, many folks want to use plant source, and they'll use flax. Contraindicated, I would not go that route. Number two, if you're going to use omega-3 oils, it must be a source that is molecularly distilled. For example, our omega-3 800s are triple refined, they are triple distilled, molecularly distilled. There's virtually absolutely nothing in the way of PCBs, PDBEs, metals, mercury, etc. That can even be found. It's 20 times below the actual organic levels that have been set, and the governmental, it's 20 times below that. Much literature in the past year has shown that many of the manufacturers are 20 times above that, so they don't even meet the specs. Ours is 20 times below the specs. High homocysteine levels. You should get an homocysteine level done. If your homocysteine level is high, increase the rates and incidence of miscarriage. Take B12. We have great forms of activated sublingual B12s. Adequate levels of folate. You already know that. Very, very important. And have a homocysteine level, or what's called a methylmalonic acid level done. We also know that eclampsia of pregnancy, a complication of pregnancy, which is in essence a fancy term for a woman becoming toxic and hypertension, developing high blood pressure, huge complications for pregnancy. Leg cramps become a huge problem. Much literature that has gone back and forth. Antioxidants don't work, they do work, they don't, they do. Literature recently shows that they do. We talk about getting women on buffered C ascorbates, magnesium, quality forms of Perfect E, which is a multi-spectrum tocotrienol tocopherol blend, can reduce the incidence of eclampsia and preeclampsia. Literature shows it. Also know that many times leg cramps in pregnancy are a sign that your nutrient, micronutrient levels are low, puts you at a higher risk. We must make sure that we're using quality sources of a multivitamin as well. We talked about EPA, DHA, especially DHA for your child that's in the womb. And lastly, I want to talk about, and I could not go into all, I'd probably have to do a segment on each, but a lot of times nausea, upset stomach, emesis gravidarum, which is in essence morning sickness that is severe. To the contrary, many times you're told by medical personnel to eat plenty of carbs, crackers. It's not really true. Literature actually shows that higher protein intake, very small amounts, along with some adequate levels of B6, some cases vitamin K supplementation, and actually vitamin C can reduce the incidence of morning sickness. Protein, small amounts is the key, not more carbs. Hopefully that covers some of the areas of pregnancy. Hopefully you've learned something and some things that will help you in this future calling for you in your future endeavors. God bless. Thanks for listening. Go to the website lenandjoe.com to acquire more details about us. Thanks.